Hello viewers, welcome back to my channel, Axia Nurse. If this is the first time of seeing my video, I'm Ashamu Oluwaseun. I'm a registered nurse. This channel focuses on content related to health. Thanks for stopping by. Do well to subscribe to my channel and hit the notification bell below to be the first person to know the next time I upload my next video. Today, I'm going to be talking about vaginal candidiasis or vaginal thrush or vaginal yeast, which usually causes itching down there. Firstly, I want to dispel some misconception about vaginal yeast or vaginal candidiasis. Some believe that vaginal candidiasis is caused by dirtiness. No, it is not. It can even be caused by being too neat, if I may put it that way, because you can have vaginal candidiasis if you overwash your vagina. Some also believe that vaginal candidiasis is a sexually transmitted infection. No, it is not true. It is not a sexually transmitted infection. Vaginal candidiasis is a fungal infection that is caused by fungi or yeast called Candida albicans. Naturally, this Candida albicans lives in the vagina with other good bacteria, and it is this good bacteria that keeps this fungi in check. But any condition that can reduce the number of these good bacteria and now give rise to multiplication of this fungi will give rise to vaginal candidiasis or vaginal yeast. So what are the causes of vaginal candidiasis? As I have said earlier on, that vaginal candidiasis will occur if there is multiplication of this fungi in our vagina. So what are those factors that can lead to multiplication of fungi in our vagina? Number one is antibiotic. When you're sick and you use antibiotics, these antibiotics fight the bacteria and it kills all the bacteria in our body, including the bacteria in our vagina. So when these bacteria are now killed, it now gives room for the fungi to multiply and now gives rise to various signs and symptoms of vaginal candidiasis. Another cause is moisture and heat. This Candida albicans thrives well in an environment where there is moist and heat. So if you are the type that wears wet panties or nylon pants, it can give rise to vaginal candidiasis because there will be heat and this fungi will now continue to multiply. Another cause of vaginal candidiasis is imbalanced pH of the vagina. Normally, the pH of the vagina is slightly acidic, but there are some things that we do that can alter this pH and now need to increase pH of the vagina, which will give rise to multiplication of the Candida albicans and vaginal candidiasis. And those things that can alter the pH of the vagina are douching. If you steam your vagina or you wash your vagina with soap, it can alter the pH of the vagina. You can wash the outer part, that is the labia and the mos pubis, with soap and water, but you must not use soap in the vagina. The vagina has its own natural smell and cleanses itself, so it does not need you to use soap to wash it. All you need to use to wash your vagina is ordinary water. Another cause is hormonal imbalance. Any factor that can lead to increased estrogen level in the blood will predispose you to having vaginal candidiasis, because when there is increase in estrogen level, it increases glycogen level in the vaginal tissue, and this yeast thrive well in high glucose environment, now give rise to multiplication of this fungi and leads to vaginal candidiasis. And those factors that can lead to increased estrogen level is pregnancy, then use of hormonal contraceptives, that is the contraceptive that has estrogen and progesterone. When you use it, it increases the level of estrogen in the blood. Then also you see that this candidiasis is most common in pregnant women, and it is because of this hormonal imbalance, that is, there is increase in estrogen level in pregnancy. So that is what predisposes them to vaginal candidiasis. Another cause is diabetes mellitus. Diabetic patients are at higher risk of having vaginal candidiasis or vaginal yeast, especially if their sugar level is not well controlled. And the reason is that this Candida albicans thrives well in high glucose environments because this glucose fuels their growth. Diabetes also weakens the immune system, thereby making it difficult to keep this yeast in check. Also, diabetes mellitus alters the pH of the vagina, leading to reduce in this good bacteria, that is the lactobacilli, and now cause multiplication of this yeast. So what are the signs and symptoms of vaginal yeast or vaginal candidiasis? Number one is abnormal vaginal discharge, that is whitish and thick vaginal discharge that looks like cottage cheese, itching, painful micturition, that is when you are urinating, you feel pains because you have scratched the side, there's already bruises urinating, and the urine touches those bruises, you feel pain. There's superficial dyspareunia, that is, you feel pain during intercourse from the bruises that has occurred on the surface from the itching. So what are the treatments of vaginal candidiasis? Since this infection is caused by fungi, antifungal is used to treat vaginal candidiasis, which can be gotten over the counter. You can use the cream or the tablet or the pessary that is inserted into the vagina, whichever one. But if you are pregnant, you should avoid oral antifungal, as it can have teratogenic effects on the fetus. It is only the cream and the pessary that can be used during pregnancy. This condition is usually common during pregnancy, but you should avoid oral antifungal. Then you should ensure that you keep your vagina as dry as possible. Then these pessaries, where you want to insert it, you insert it at night, where you know you are no more going out, because when you insert it during the day, this thing can come down. You should ensure that you pass it as high as possible. There's already an introducer there that you can use to introduce it as high as possible, so that you kill those fungi up there. Don't just kill the one at the superficial level. If you kill the one down there, the one up will still continue to multiply and the symptoms will not go. So when you pass it as high as possible, you see that you'll be relieved within days of starting antifungal. So what are the prevention of vaginal candidiasis or vaginal thrush? Wash the vagina with only clean water. No douching. Don't use soap to wash the vagina. Don't steam your vagina. Don't put deodorant. Don't use any strong soap on your vagina. Don't even use soap to wash your vagina. Then avoid indiscriminate use of antibiotic. Use antibiotic only when it is needed and it is prescribed. Ensure you keep the vagina dry and clean. Avoid wet and damp panties or underwear. Wear breathable clothes as underwear to allow air into the vagina. Avoid nylon panties. Ensure good glucose control if you are diabetic. Then if you want to wash your vagina, ensure you wash from front to back and not from back to front to prevent contamination. And this has brought us to the end of today's video. If you find this video informative, do well to subscribe to my channel, like, share with your friend, and hit the notification bell below to be the first person to know next time I upload my next video. See you next time.